Okay, diving straight in today, we're doing something a bit different. We're using your source material thanks to the listener who sent in these fantastic revision notes on norovirus.
Yeah, great notes. And our plan is to unpack these together, pull out the really crucial bits, and make it super high yield for your revision.
Exactly, a guided tour through the need-to-knows of norovirus. Because, it's often just called the winter vomiting bug or stomach flu.
Right. Dismissed a bit, maybe?
Yeah, but it's everywhere. And these notes have some genuinely surprising details. I'm keen to dig in because, well, many of us have had it. But understanding the why it's so effective, is key.
Agreed. So let's start right at the beginning. What is norovirus according to these notes?
Okay, so first up, the common names we mentioned. Winter vomiting bug, stomach flu. Pretty descriptive.
Mm-hmm.
But the formal definition here is a highly contagious virus causing acute gastroenteritis. Short, sweet, gets to the point.
And the technical detail, it's an RNA virus, part of the Calliciviridae family, which interestingly connects later to things like Shellfish mentioned as a source.
Ah, nice link already. And the impact is just massive. These notes say it's behind 1 in 5 cases of gastroenteritis worldwide. That's huge.
It really is a global thing.
Yeah.
And classification-wise, there are 10 genogroups, apparently, but the main ones for us humans are GI, GII, and GIV.
And it's not static, is it? The notes mention emerging variants, like GI.4 Sydney 2012, so it's always changing.
Constantly evolving, yeah, which makes things tricky.
And right from the start, how it spreads is laid out. Fecal vomitus, oral route, contaminated objects, food, water. Straight away, you get the picture this thing gets around easily.
Definitely, which takes us nicely into the etiology or, the cause. It's the norovirus genus itself, obviously, but that strain diversity we just touched on is important.
And those transmission modes again. Contaminated food or water, close contact, touching contaminated surfaces, multiple routes in.
So thinking about those routes, certain situations obviously put you more at risk. What risk factors are highlighted in the notes?
Well, the big one that always springs to mind is close quarters, right? The notes call out nursing homes, cruise ships specifically.
Oh, yeah, the classic cruise ship outbreak scenario.
Exactly. But also just frequent exposure to crowded places in general. Makes sense.
And poor sanitation, obviously, and inadequate hand hygiene. That's listed as critical. It all ties back to how easily it spreads.
Okay, so pathophysiology. Let's get into the mechanism. What's this little RNA virus actually doing inside the body to cause all the misery?
Right, so to get the symptoms, you need to know what it's attacking. The notes say it infects the intestinal epithelial cells. It gets right into the lining of your gut.
It invades them.
Precisely. And that invasion, that infection, causes inflammation and damage to those cells.
Okay.
And that damage disrupts the gut's main job, absorbing nutrients, absorbing water. Digestion gets messed up.
Ah, right. So the vomiting, the diarrhea, that's the direct result of the virus, basically
Yeah.
breaking the absorption system,
Yeah.
damaging the gut lining itself.
Exactly. That's the chain.
Yeah.
Infection leads to damage, which leads to disruption, which leads to the gastroenteritis symptoms. That's the why.
Okay, crucial bit for revision now. Differential diagnosis. Someone comes in sick.
Mm-hmm.
How do you work out if it's noro or something else?
Yeah.
The notes list, rotavirus, bacterial stuff like salmonella, campylobacter, other viruses too.
Yeah, and this is where the detail in the notes is really useful. For norovirus itself, the flags are sudden onset vomiting, often the first and main thing. Then the short duration, usually that 24 to 48 hours we keep mentioning.
Right.
And often a history of contact, someone else they know is sick, those three. Sudden, short contact. Big clues.
Makes sense. If the whole family goes down one after the other,
Yeah,
noro's likely.
definitely. Now compare that to, say, salmonella. The notes mention a potentially longer incubation, 6 to 72 hours, sometimes more, often linked to contaminated animal products. And symptoms might include bloody diarrhea, often a higher fever than with typical noro. Different feel.
And rotavirus. The notes seem clear on that one.
Yeah, the key differentiator mentioned is age. Primarily affects children under 5. That helps narrow it down.
Okay. And E. coli.
Often a longer incubation, again, maybe 3 to 4 days, could be up to 10. And the notes highlight severe abdominal cramps and often bloody diarrhea there too.
So, okay, there's overlap, obviously. But onset, specific symptoms like blood or high fever, potential sources, and age group, all clues from the notes to help differentiate. They also list other things like parasites, even non-infectious gut issues.
Yeah, it reminds you the picture can be broad, but focusing on these common infectious ones and their features is key for that initial assessment.
Right. Let's talk epidemiology. Where and when is this virus causing the most problems? The notes mention UK data specifically. It's a massive cause of outbreaks, especially in those closed settings, hospitals, schools, care homes.
Anywhere people are close together, basically. It hits all ages, though, as we'll see. Complications are worse at the extremes. And yeah, confirming the name, it's more common in winter.
And the scale.
Yeah.
Estimated 3 million cases a year in the UK.
Yeah.
That's staggering. Huge burden.
It really is. Significant costs involved, too, obviously.
Okay, clinical features. Let's get specific. What are people actually experiencing the symptoms, and what signs might you look for? Notes, break it down.
Symptoms first. Onset is usually fast, like we said, 15 to 50 hours post-exposure. Then the classic list: nausea, vomiting, diarrhea, cramps, maybe headache, low-grade fever, muscle aches.
And the notes stress that most people get both vomiting and diarrhea,
Yeah.
right? That combination is typical noro.
Yes, exactly. Fever's pretty common, too, up to about 47% according to this, so nearly half will have some fever.
And duration usually short, 24, 48 hours.
Typically, yeah. But important point, it can be longer, more severe, especially in the very young or people already in hospital.
Right. Most healthy folks bounce back in a day or two, though the notes say diarrhea might linger a bit longer sometimes.
There's also a quick mention of occasional seizures, but thankfully long-term neurological stuff is rare.
Okay, and signs. What would you see?
Well, the notes are pretty clear. There aren't really any unique physical signs for noro. It just looks like standard gastroenteritis. The absolute main thing to look for, the key sign, is dehydration.
Especially in the vulnerable groups, little kids, older adults.
Absolutely. Signs of severe dehydration are listed. Low blood pressure, electrolyte problems, which can be dangerous and even collapse in really bad cases. So monitoring hydration status is paramount.
Okay, transmission again. How does it spread so well? Fecal oral, we know. But the notes highlight something else. Aerosolization.
Yes, this is such a high-yield point for understanding outbreaks. It means tiny virus particles can become airborne. How? Forceful vomiting, or even just flushing a toilet that's contaminated.
Wait, flushing the toilet can aerosolize norovirus. That's genuinely unsettling. But it explains so much about how it ripped through places like hospital wards or households.
It really does. Combine that with direct contact, maybe someone preparing food while infectious. And the virus is tough. It survives on surfaces, gets in, sets up shop in the small intestine, replicates.
And here's another jaw-dropper from these notes. The infectious dose. How little virus it takes. It's estimated at just 10 to 100 viral particles.
10! Think about that. 10 virus particles. It's almost nothing.
No wonder it spreads like wildfire. A microscopic amount of contamination.
Exactly. Explains why containment is so hard. And worth noting from the source here, it's not currently a notifiable disease in the UK, which impacts tracking.
Okay, so limiting spread is everything. Key measures from the notes. Isolation first, especially in high-risk settings like hospitals, care homes.
Essential. And hand hygiene, number one.
Yeah.
But there's that crucial memory tip in the notes here.
Ah, yes, the alcohol gel thing.
Vital point for revision. Proper hand washing with soap and water. The notes are explicit. Alcohol hand gel is less effective against norovirus.
Right. That needs highlighting. People reach for the gel, but for noro, it's got to be soap and water. Big takeaway.
Definitely star that point. Soap and water are your best bet.
Okay, investigations. How do we actually confirm it's norovirus? Diagnosis is mostly clinical, right? Based on the symptoms, the sudden onset, exposure history.
Yeah, primarily clinical for straightforward community cases. The notes say testing often isn't needed if it's mild and managed at home.
But testing is done sometimes.
Yes, stool sample testing, especially in outbreaks. Helps confirm noro, identify the strain, maybe find the source, like contaminated food.
And what tests are run on the samples?
The notes list ELISAs, they detect viral antigens. And PCR that finds the virus's genetic material, the RNA.
Which one's better?
PCR is flagged as the current gold standard test. Most sensitive.
Good to know. What about antibody tests? Do they help?
Not for diagnosing a current infection, the notes explain, because so many of us have had noro before, maybe without even knowing it. We have antibodies, so finding antibodies doesn't tell you if you're sick now.
Right. Subclinical infections mean antibodies are common anyway. Makes sense. And other blood tests. Kidney function, electrolytes.
Only if complications are suspected, mainly dehydration. Routine tests aren't usually needed otherwise.
Right, let's shift to management. The main focus isn't some magic bullet cure, it's supportive care, yeah. Managing symptoms, preventing dehydration.
Absolutely. Core advice, rehydration, getting fluids in. electrolyte replacement, often with those oral rehydration solutions, and just a bland diet while things settle down.
And the notes have specific advice on common meds people might reach for.
Yes, a strong recommendation against using anti-vomiting or anti-diarrheal drugs routinely.
Really, why is that?
Well, the thinking outlined is they might mask how severe things are or potentially even keep the virus hanging around in the gut longer. Better to let the body clear it.
Okay, so supportive care is key.
If
And
you-
then it's back to stopping the spread. Notes mention increased cleaning, disinfection, dealing with spills promptly.
Remembering the aerosols. Good ventilation helps too. Rigorous hand hygiene, soap and water. And advising affected people to stay away from food prep.
And there's a specific time frame for that food prep rule in the notes, isn't there?
Yes, super important. Avoid preparing food for others for at least 48 hours after symptoms have completely stopped. Not just when you start feeling better.
2 full days clear.
Correct.
Got it. That's vital for stopping secondary cases.
Crucial. Hospital admission is really just for severe dehydration or vulnerable people who can't manage fluids at home.
And prevention overall basically boils down to good hygiene, safe food practices, avoiding contact when sick.
Those are the cornerstones, yeah.
Which leads us to prognosis and complications. Generally, for healthy people, the outlook is good.
Usually, yes. Notes say recovery typically within 72 hours. Pretty quick bounce back for most.
But complications are more likely in those vulnerable groups.
Mm.
The very young, the elderly, the immunocompromised.
Correct. And the main complication comes directly from the main symptoms. Dehydration and the electrolyte imbalances that follow severe vomiting and diarrhea. That's why IV fluids are sometimes needed in hospital.
And for those with weaker immune systems.
The notes mention noro can potentially lead to secondary infections or just make existing health problems worse. Recovery can be slower, more complicated for them.
Okay, so pulling out some final prevention points again from these notes, person to person, fecal-oral route is king.
Education is key, making sure people understand how it spreads, the hygiene needed, avoiding risky food or water sources.
Like the specific mention of avoiding raw, unwashed produce and shellfish during known outbreaks brings it back to potential sources.
Exactly. And dealing with contaminated environments, especially bathrooms, proper cleaning, using gloves.
Notes also highlight healthcare settings being frequently affected and how acting fast with control measures shortens outbreaks there.
Absolutely critical in those environments.
And this point just hammers home again because it's so important and clear in the notes. You remain infectious for at least 48 hours after your symptoms resolve. Feeling better doesn't mean you're safe to be around others or handle food.
Such a key message. 2 full days symptom-free. And one last thing, natural immunity, it's short-lived and probably only protects against the specific strain you had.
Meaning you can definitely get norovirus again and again.
Unfortunately, yes. It's not a one-and-done virus.
Wow. Okay, so pulling all that together from your notes, norovirus, incredibly infectious, tiny dose needed, spreads via aerosols, beats alcohol gel, hangs around after symptoms stop.
Yeah.
It's quite the opponent.
It really is. And given all that, the easy spread, the low dose, how it lingers, it does make you think, doesn't it? How does this challenge our usual ideas about hygiene and public health? What's the next step beyond just washing hands to really tackle these widespread outbreaks? These notes certainly highlight what a persistent adversary it is.
A really good question to ponder. Well, that was a fantastic deep dive into your norovirus revision notes. We've hit the definition, causes, risks, how it works, telling it apart from others, the epidemiology, symptoms, signs, those surprising transmission details, diagnosis, management, outlook.
Hopefully, running through all those high-yield points from the source material you sent in has helped cement them for your revision. That was the goal.
Definitely. Thanks so much again for sharing these notes for the deep dive.
Right.
Really insightful stuff.
My pleasure. Always interesting to get into the details.
And for everyone listening, for more resources to help with your revision, do check out pastthemsra.com and freemsra.com. We'll catch you on the next deep dive.